The hidden reason black people don't trust hospitals.
Try to stay still, Mr. Turner.
What are you gonna do?
Just a little trim, won't take but a moment.
Picture this. A black mother stands in a dim hallway of a segregated hospital in the mid-20th century, clutching her purse while nurses rush past her without speaking. Her child is somewhere behind those metal doors. Scope News does a deep dive, and she can feel the weight of every warning passed down through her family. Don't let them take you out of your sight. She doesn't know the full history, but she feels it. The system was never designed with her family in mind. Behind those walls, decisions have been made for generations that harmed black bodies, erased black pain, and turned black patients into afterthoughts. The distrust you see today didn't appear randomly. It was built brick by brick. The history begins long before modern medicine pretends to be fair. In the 1840s, J. Marion Sims, celebrated in textbooks as the father of modern gynecology, he performed repeated surgeries on enslaved women, including Anarcha, Lucy, and Betsy, without anesthesia. Their names are documented. Their suffering is documented. Their consent, it was never sought. Sims's experiments were recorded in his own writings. Hospitals inherited his methods, his assumptions, and his bias. By the 20th century, systemic harm simply took new forms. Black Americans were routinely denied hospital admission under Jim Crow, but the government also quietly sanctioned medical discrimination in more subtle ways, until one landmark case pushed back. In Simpkins v. Moses H. Cone Memorial Hospital, 1963, dentist Dr. George C. Simpkins, Jr., alongside other black plaintiffs, sued 2 North Carolina hospitals for refusing care to black patients despite receiving federal Hill-Burton funds. The case went to the Fourth Circuit Court of Appeals, which ruled that federally funded hospitals could not segregate or refuse black patients. It was the first major civil rights victory before the Civil Rights Act of 1964. This case is real. It changed policy. But it came only because black people forced change through the courts, not because hospitals protected them. Even outside this legal battle, black communities created their own institutions because they had no choice. In Mississippi, the Afro-American Sons and Daughters Hospital, founded in 1924 by T.J. Huddleston Sr., treated thousands of black patients denied proper care elsewhere. It became one of the most important black-run hospitals in the South, a reminder that trust in white hospitals was already broken long before federal law acknowledged the problem. The existence of this hospital is not myth. It is documented proof that black people built alternatives to survive. And of course, we cannot forget the case they tried to bury underneath decades of silence. The Tuskegee syphilis study that begun in 1932, it wasn't an accident, a misunderstanding, or a mistake, no matter how gently the government tries to phrase it today. It was a deliberate slow death, engineered by white physicians who stared black men in the face, promised care, and instead watched their bodies rot from the inside out. They let those men go blind. They let their organs fail. They let the disease crawl into their bones. They even watched as wives were unknowingly infected and children were born damaged by an illness the government already had the cure for. They wrote reports, they took photographs, they documented suffering as if black pain were a scientific specimen. 40 years. 40 years of orchestrated destruction carried out by people who called themselves healers. No one batted an eye at Dr. John Charles Cutler, who did such a lengthy and heinous study on black people. And this distrust didn't fade with time. In 2020, during the COVID-19 pandemic, a black physician named Dr. Susan Moore recorded a video from her hospital bed describing how her symptoms were dismissed, how she had to beg for diagnostic imaging, and how her pain was minimized by white staff who doubted her.
Yesterday, Dr. Bannock, B-A-N-N-E-C, wanted to send me home. You know, at that time I'd only received 2 treatments of the remdesivir. He says, you don't need it. You're not even short of breath. I said, yes, I am. Then he went on to say, you don't qualify.
Her testimony is on video. Her story was reported nationwide. She died soon after being discharged. The medical system she worked in did not protect her. In 2025, distrust surged again when videos involving Black pregnant women, Carrie Jones and Mercedes Wells, went viral across the country.
Mounting concerns over this video that appears to show Carrie Jones in active labor at Dallas Regional Medical Center in Mesquite, Texas, last week.
Y'all treat all your patients like this or just the Black ones?
Jones's mother posting the video on social media.
I said, can we get her into labor and delivery? She said, no, we have to fill out all this paperwork.
The family alleges hospital staff delayed Jones's care for more than half an hour. In a statement to NBC News, the medical center says in part that we are committed to providing compassionate, high-quality care to every person who comes through our doors, and we are reviewing this situation to understand what occurred. In the U.S., Black women report facing disproportionate levels of unfair treatment in healthcare settings and are 3 times more likely to die from a pregnancy-related cause than white women. In Crown Point, Indiana, another alarming video. Mercedes Wells says she sought care from Franciscan Health Crown Point Sunday. She says they sent her up to triage, where she labored for 6 hours, and a nurse gave her a checkup.
After she finished, she said, well, if you're not further along and you're not past 3 centimeters in the next 2 hours, then we're going to discharge you.
Wells says she never saw a doctor, and minutes after being discharged, she gave birth in the car. How did it feel after you gave birth? Not at the hospital, but in your car.
I felt like I was put out on the street.
Did you think you could lose them?
I did, and that's what messes me up.
The hospital's president and CEO, Raymond Grady, says in part, we must fix what we failed in our hospital. The physician and the nurse directly involved with Mrs. Wells' care are no longer employed by Franciscan. I apologize to Mrs. Wells and her family. This video going viral, not just resonating, but renewing concerns about racial disparities. The CEO also adding that he has mandated cultural competency training for all labor and delivery staff.
Both women were filmed pleading for help while nurses dismissed their labor pains. The footage was undeniable. Even with cameras recording, even with contractions visible, their concerns were brushed aside. For millions of Black viewers, these videos weren't shocking. They were familiar. These moments simply confirmed what their elders had been saying for generations. What makes these cases powerful is that they aren't rumors. They aren't folklore. They are documented. They happened on camera, in court records, in newspapers, in medical journals, and they represent a pattern. Studies from the CDC consistently show that Black women are 3 to 4 times more likely to die during childbirth than white women. Not because they are biologically different, but because they are not believed, not prioritized, and not treated with urgency. Even Serena Williams, one of the most famous athletes on earth, was nearly dismissed when she reported post-birth complications. If she had to fight to be heard, the danger for everyday Black mothers is clear. Picture that same mother from the hospital hallway decades ago. She didn't know about Sims or the Simpkins case or CDC mortality charts. She knew only what every Black family learned through experience. Be careful. Don't be alone. Ask questions twice. Don't trust blindly. And today, when Black patients bring a family member to appointments, research their symptoms before seeing a doctor, or hesitate before going to the ER, it isn't irrational fear. It's historical memory. The distrust is justified, it is earned, it is documented. Until hospitals confront this history honestly, not in corporate brochures, but in real policy, real accountability, and real acknowledgement, Black families will continue to ask the same question whispered across generations.
Will I be safe here?
Scope News tells the truth. Here are the facts. All cases in this report are verifiable through public historical records, medical documentation, and national news reports. Sources include J. Marion Sims's surgical experiments on enslaved women, 1840s, documented in Sims' own writings and medical archives. Simpkins vs. Moses H. Cone Memorial Hospital, 1963, documented in Fourth Circuit court records and medical civil rights literature. Afro-American Sons and Daughters Hospital, documented by Mississippi Historical Archives. Dr. Susan Moore's COVID-19 testimony, 2020, reported by the Washington Post and other major outlets. Viral 2025 clips of Black pregnant women Carrie Jones and Mercedes Wells, confirmed by multiple national news organizations. Legal disclaimer. This content is for educational, informational, and entertainment purposes. Scope News aims to reflect historical events accurately according to available records and reputable reporting. Some historical accounts contain gaps, conflicting documentation, or culturally suppressed material. Viewer discretion is advised for topics involving racism, violence, and medical trauma. This report does not provide medical, legal, or professional advice.